Welcome everybody to our CME CNE presentation by our one and only Dr. Longhurst. So let me tell you a little bit about her. She is an assistant professor, a licensed clinical psychologist, and psychology training director in the Texas Tech University Health Science Center, El Paso Department of Psychiatry. Dr. Longhurst also works in collaboration with residents and faculty in the TTUHSCEP. Wow, that was a mouthful right there. Felt like I was taking the eye exam. I'm sorry. Department of Family and Community Medicine Kenworthy as a behavioral health specialist and core faculty member of the residency program. She's earned her master's in education in guidance and counseling from the University of Texas at El Paso and a PhD in counseling psychology from Texas Tech University. She has completed her pre-doctoral internship and post-doctoral fellowship in clinical psychology at the South Texas Veteran Health Care System, specializing in primary care, behavioral health integration, and health psychology. She is a native El Pasoan and passionate about increasing access to mental health services and wellness, as well as multicultural issues impacting our community. Thank you, Dr. Longhurst, for taking your time presenting us with this much important topic, especially for me. Sleep is important. Thank you. So go ahead. It's all yours.
Thank you. It's nice to see everyone who's on here. Thank you for attending from all the different places. We're glad to have you. So some of the objectives that we have are understanding the importance of sleep after this presentation, as well as knowing the recommended amount of sleep we should be getting. And then, of course, I think what is most important is learning strategies to get healthy sleep. Here's some additional information on CPAN. So sleep is not just something that I think many of us enjoy doing, especially when we're sleep deprived, but it really serves an important function. And that includes forming pathways in our brain that's going to help with learning and creating memories that's going to help us to focus and respond quickly, which is why there's always these recommendations before you take a test or you have a big day that you get a good night's sleep. And then also, limiting tasks that require focus and quick responses. So like driving, for example. It also gives your heart and vascular system a much needed rest while you sleep. And then your hormones are released during sleep that control your body's energy. And of course, we've probably all heard that it improves our body's responses to infection. So it's important that we get rest and, of course, that we get sleep, not just rest. I thought it was important to share the impact the pandemic has had on us. And so in a survey of US adults, this was taken back in February, you can see here that 67% of adults surveyed in the US reported sleeping either more or less than desired. And so this is important because you can see the other reports here. Undesired weight changes were also reported, as well as drinking more alcohol to cope with stress, delayed or canceled healthcare services, increased levels of stress, and then increased levels of stress with parents. And so when you think of all this and how it fits together, it's kind of difficult to determine what came first, the chicken or the egg with some of these, because all of these reported changes impact one another in some way. So it's difficult to discern which is the catalyst. But the important part to note is that sleeping was definitely impacted. And our sleep was impacted either because of changes in our work environments, being at home with children, changes in our schedule, but also if you can think about increased amounts of stress, decrease in structure for many of us, including our children. And so as providers, we're working across the lifespan, I imagine, the folks that are on here right now. And so it's important to recognize that sleep is quite important in our daily functioning. And so that being said, there's always a question of how much sleep do we need. There are those people that are, I'll sleep when I'm dead, or, I'll just, who kind of gloat about not getting enough sleep and being able to function. But truly, it's important, as I just mentioned, it serves a function. It helps our body and brain restore itself in order for us to function optimally. So for newborns, they should be getting, the recommended amount of sleep is 16 to 18 hours. Preschool aged children, 11 to 12. School aged and adolescents, at least 10. And then adults, at least 7 to 8 hours. And so I want you to reflect on that and determine if you have been getting the recommended amounts of at least 7 to 8 hours. And if not, how has that been impacting you? As well as maybe your children or other children in your lives, or even the population that you serve, the patients that you serve. What are some of the problems that you've seen as a result that could be leading to the sleep of the sleep issues? And what could be leading to these sleep problems? And to be honest, just talking about sleep makes me sleepy. I feel like this little creature right here. So lack of sleep can cause things like mood problems, and mood is really associated with sleep. So in terms of depression, when somebody is depressed, they may be sleeping a lot more or have difficulty sleeping. And then when folks are feeling anxious, they have a difficulty sleeping because they're usually staying up all night, worrying and thinking. And then a lack of sleep can also cause irritability and frustration and anger, then cause interpersonal problems, because when we're tired, many of us, me, for example, I'm not really fit to be around. If I'm tired or hungry, I'm kind of grouchy. And so then that could lead to other problems. And then it's also a lot of difficulty focusing. So chronic lack of sleep can also cause increased risk for things like obesity, diabetes, cardiovascular disease, as well as infections. And at this time, when we're thinking about COVID, and also some of the fallout. I know I work in primary care, and we were talking about seeing some of these other types of conditions that you would normally see in other seasons, but because people have mostly been at home, sequestered, then they're not exposed. And so their immune systems have adjusted. And now we're starting to see a lot of things like strep throat and people coming in with infections that they would normally get at other periods, but it's because they've been home away from people for so long, wearing masks. And now as things are becoming more lax, we're starting to see some of these other issues. And so it's important that we maintain our sleep to help keep ourselves healthy and our patients healthy. So there's a biological clock that also plays a role in our sleep. And this is important to understand because it's a collection of cells in our brain that control our sleep patterns. And so what's happening is that it helps to control both internal and external environmental cues. So light signals to our eyes, that impacts our sleep. And so now when we think of all of these devices that we usually are scrolling on, we've spent the last year on many devices. Our children have as well, whether it's in front of a computer screen for school, but also iPads, television, and then natural light. So this is all disruptive when you think of back when we didn't have artificial light. Our biological clock was going off of natural light, but now we have a lot of different artificial light that interferes with our biological clock. And so our biological clock also helps to trigger production of melatonin, and it helps us to prepare our bodies and our brain for sleep. And so naturally, based on this clock, we'll feel the most tired between midnight and 7 a.m., which is when most people are sleeping or should be sleeping, and then mildly sleepy between 1 to 4 p.m. So if you struggle with that like post lunchtime slump, you're not alone. And it's, biologically, we're kind of wired in a certain way. So I think it's important to understand sleep tips that are, I wish I could sleep like this little guy. I feel like if I close my eyes right now, I probably could. Um, but I think it's important for us to understand some tips that we could put into practice very readily with our patients. And so I am trained in cognitive behavioral therapy for insomnia. And these will be some sleep tips that are related to that, but they're not the protocol. It's not cognitive behavioral therapy for insomnia the way we would put it into practice. But I pulled some of the tools that I thought would be most helpful for our primary care providers or mental health providers that are on this call, and things that you could implement pretty readily, even in a few minutes with a patient in a session. So you don't need the whole protocol to see some effects if the patient is willing to put some of these into practice. So sleep hygiene. Many people really struggle with sleep hygiene, and their sleep hygiene is actually poor. So it's important to ask some of these questions to determine what their sleep hygiene looks like and if there are some changes. And many times by implementing even a small change, it can have a big impact on the quality of sleep that they're getting. And so even when we are talking about CBTI, initially the focus is on improving and increasing the sleep quality and not necessarily the sleep quantity, which some people struggle with that notion. But the idea really is by getting better sleep, then we can start to work on getting longer sleep. So stretching that out. But what's the point if you're in bed all day, but your sleep quality is poor? That's not very helpful. So some areas that you can work on with your patients is on, or even with yourself, if you're having some sleep difficulties, is so starting with sleep hygiene, a consistent wake up time. This is really hard for people to want to implement. And so, but it really does have a big impact on strengthening our circadian clock signal. So being able to respond to that structure, that signal of this is my wake up time, this is my sleep time. I'm pretty regimented with this. And so I tend to wake up at the same time, even on weekends. And it's not just about waking up, but it's also getting out of bed when you are not sleeping. So not laying there watching TV, not laying there, on your phone, not laying there reading a book or checking email, things like that. The bed should really be used just for sleep and intimacy. And so this will also help to increase our sleep drive. Why is that? So if we think of back to Pavlov and basic kind of reinforcement behaviorism. So when we think of this, there is going to be this association between the bed and sleep. And so we want to strengthen that association with seeing the bed and just thinking about sleep, not thinking about, I'm going to worry about the day. I'm going to worry about the next day. I'm going to do work. The bed, we don't want to associate it with anything but sleep. And so by waking up consistently, we can help to increase our sleep drive also, because we're not taking pockets throughout the day by taking naps. And so by taking naps, then we're removing some of that sleep drive, right? We're not increasing our sleep debt. So we want to increase our sleep debt throughout the day. So by limiting naps, especially those too close to bedtime. And I'm not talking about this 10 to 15 minute power nap that I'm not sure anybody has a chance to get, but if you do, that can be refreshing. I'm talking about these longer naps that, 2 hours, 3 hours, that can really take a big chunk out of the sleep pie. So if you think of a pie, and if you just keep taking pieces throughout the day, you're not going to have very much at the end of it, right? So at nighttime, so you're not going to be sleepy at night, and then you're going to run into sleep problems as you continue. So you want to limit sleep naps, especially if you're having sleep problems. So I always ask patients, do you take naps throughout the day? Do you wake up throughout do you wake up at the same time every day throughout the week? Because if you also are thinking about that. If you sleep in on the weekend, then you're also taking parts out of that pie. And then when it comes time for bedtime on Sunday to get ready for work or school on Monday, you're not sleepy because you already slept throughout the day. So you want to make sure to be consistent. Exercise is good. Exercise is really good. It has benefits on our mood. It helps to improve our mood, boost our mood. It helps to decrease arousal. So some of that, those like feelings of like jitteriness or physiological sensations that we feel when we're anxious, it can help to decrease that. Of course, it has health benefits as well as mental health benefits, and it can improve our sleep. However, you want to make sure that you're not exercising too close to your bedtime because it energizes us for a time. And so if you're doing it too close to bedtime, then that could lead you to feel too energized for your, bedtime, and then you're going to have sleep trouble. And then again, you're kind of should be getting the gist right now that it's like this domino effect when you are not really adhering to the sleep hygiene recommendations. Avoiding caffeine, nicotine, and alcohol before bedtime. So caffeine, of course, it's going to activate us. Nicotine also is activating. A lot of people feel relaxed or report feeling relaxed after they're smoking, but that's sometimes just calming the withdrawal symptoms. And that's why first thing when they wake up, they feel like they should get a cigarette because they haven't had a cigarette all night. And so it's helping to soothe that. But nicotine is actually activating. And then alcohol. There are a lot of folks who start to turn to alcohol, I've seen, in order to manage some of their sleep troubles. Now, it can help us go to sleep. However, once it's metabolized in our system, then it actually disrupts our sleep. So I do ask about substance use. I do really recommend and try to provide some psychoeducation on the effects of these substances, especially when somebody is using alcohol to sleep, because then they start to wonder, why isn't it working and why is my sleep disrupted? But the quality of sleep is poor. And again, we want good quality sleep. We don't want to just lay in bed for 7 to 8 hours. That does not equate to sleep. And then large meals or caffeine. So we want to avoid or large meals and beverages too close to bedtime. So large meals, that can really help. That can really disrupt sleep because as we're digesting and if we're eating something that's causing things like heartburn, beverages, we have to get up and go to the restroom more often, which disrupts our sleep. So it's good to get to know what your patterns are, your behavioral patterns, and your patients are throughout the day, because one minor change can really have a big impact. And I'll share an example of a patient that I was seeing. Elderly patient, I think he was in his 90s, really in kind of optimal health, was just having trouble with sleep. And so something that he was doing was he was getting up. When he would get up in the middle of the night, he would start to do push-ups because he thought that should make me tired, which should make me sleepy, and then it should improve my sleep. And when I asked him to maybe exercise earlier and not get up and exercise in the middle of the night, but to do something more relaxing, like a relaxation exercise or meditation, he wasn't quite on board because he thought, oh, this is tiring. This should theoretically tire me out, right? The exercise. But by just making that change, his sleep improved substantially. And so we didn't even have to make too many other changes because everything was pretty good. But that one change really had a huge impact. And so he started working out earlier, and that really helped him to go to bed and stay in bed throughout the night. And what was funny is he mentioned that his grandson had told him, it actually energizes you for quite a bit. Maybe you should try it at a different time. And he was like, no, you don't know what you're talking about. And so I think sometimes we experience that too, right? Family members might be talking about having sleep difficulties, or some of our friends or loved ones, but they'll look at us and think, what do you know? Even though we might be more of the experts, they don't really take that into account. So getting to know your behavioral patterns, what are you doing, as well as your patients can really help to identify what are some even minor changes that can be made that could potentially have a large impact on their sleep quality. And then maintaining a dark, cool, and comfortable sleep environment. So never underestimate the power of this environment, because as we talked about, our circadian rhythm, our circadian clock, we're responsive to things like light. And so if we're in a bedroom, so even like this room that I'm in right now, that's very well lit, it has a lot of natural light. It may be difficult for me to sleep if I'm trying to sleep right now. Let's say I work a night shift and then this is my bedroom, it might be too bright. A lot of people struggle when they move up north, let's say to Alaska, because during certain parts of the year, it's mostly dark. And then during other parts of the year, it's mostly light. And so their sleep really takes a hit. So maintaining a dark, cool, comfortable environment. So our body temperature changes also while we're asleep. So you want to make sure that it's cool. And then being able to have maybe some like dark shutters or window treatment, or wearing an eye mask, which I do every night because I am very quickly impacted by light. So even if somebody, let's say one of my kids has to turn on a light for some reason, I'm done. I will have a very difficult time returning back to sleep. And then getting a good mattress and pillows. This costs money and this is expensive. So of course, recognizing that and those limitations with your patients, but trying to focus on some of the other behaviors, because often there are other behaviors that are getting in the way. And then talking to, of course, recommending when to take medications, like when that is necessary. But the thing is that medications don't always, that's not the first line. It really is cognitive behavioral therapy or some kind of behavioral changes that are going to have the longer impact, because eventually the sleep medication doesn't work as long. Additionally, maybe treating mood, that might be an issue that's impacting their sleep. And something that's not mentioned here in regards to light is our phones, electronics, limiting electronics from your room and your routine, creating a buffer before you go to bed that limits electronics, no watching TV in the room, and really setting aside that time and recommending that with children as well. I know a lot of people who they say, well, my child has to, get on their iPad in order to go to sleep, or they have to watch TV in order to go to sleep. But that light is also impacting us even when we don't recognize it. And then also recognizing OSA. So there might be obstructive sleep apnea. So making sure that you are asking those questions. Are they snoring? Has someone reported that they snore? Are they waking up gasping for air? Do they wake up not feeling rested even after getting 7 hours of sleep or a good night's rest? So just making sure that you're asking these questions and then referring out for a sleep study if needed, if there is potential for obstructive sleep apnea or another disorder that might be impacting their sleep. All right, so as I mentioned, we want to strengthen the bed as a cue for sleep. So kind of that Pavlov's response, right? Where, the dogs were kind of just the sound of a bell was creating that salivation. So we want to associate the sight of a bed with I'm getting sleepy. And I really am at that point where I've strengthened the cue between my bed and sleep pretty well, that if even during the day, I could probably just like the sight of my bed would make me go to sleep. So you want to only use the bed for sleep and intimacy. Go to bed only when you're sleepy. So a lot of people think if I go and just lay down at 8 p.m., then that should be enough, right? I should just magically fall asleep. But if you're not sleepy and you're going to bed, then you're actually decreasing the strength of that association, because now the association is I go to bed and I lay down and I just think or worry about whatever it is that is on my mind at the time. So you want to make sure that the bed is associated with sleep. So you're going to bed only when you're sleepy, and that you're getting out of bed when you're unable to sleep. So if you have people that are waking up in the middle of the night, recommending that they get out of the bed after about 15 to 20 minutes and just getting a feel for it, and not being kind of just stuck looking at the clock, because then that creates more worry, more thoughts of, oh no, it's 4 a.m. I can't go to bed. By the time I go to sleep, I'm going to have only, slept about 5 hours and I'm not going to be able to function, because that's how our brain works, right? So then we're up another hour worrying about how we're not going to function when we wake up in an hour, or when our alarm goes off in an hour. So you want to really recommend that if somebody's not able to sleep, instead of just laying there for hours on end, that they get up and they do something calming and relaxing, and then return to bed when they are sleepy. All right, night shift. So I mentioned this because I recognize a lot of our providers sometimes have night shift, or sometimes some of our patients. So there are some differences in dealing with folks that work with the night shift. So you want to increase their total sleep time by adding naps and lengthening the amount of time you allot for sleep. And so that's different because when they're able to sleep might change, right? And so if they're able to, take a power nap, or find other ways to fit in sleep throughout their day, then that's recommended. Using bright lights while at work in the workplace. So that way they're not feeling sleepy. And then you're hoping to get back onto that shifting your circadian clock and circadian rhythm, right? Because we're naturally getting sleepy from midnight to 7 a.m. But for somebody that's working the night shift, you need anything to help keep you awake during the hours you should be awake, and then anything that's going to help you go to sleep during the hours when you should be sleeping. So during the day. It's really, really difficult when somebody has constant changes in their shifts. And so that is a whole other topic and a whole other talk, but trying to minimize. So if you are responsible maybe for scheduling, and there's ways to minimize the number of shift changes, then that is helpful, because then somebody is not having to constantly try to shift between day and night, because it's very difficult to do. And then they're not functioning well, they're not focused, and they're having more of a struggle to be productive at work. So, or trying to focus at work. So trying to minimize the number of shift changes is helpful. Getting rid of sound and light distractions during daytime sleep. So that's really like to have blackout shades, an eye mask, a white noise machine maybe could be helpful in drowning out any outside noise. And then making sure to make it as dark and cool as possible. That way the person can try to sleep and try to limit the light that's coming in during their daytime sleep. And then using caffeine only during the first part of the shift, because again, if somebody is drinking coffee or some type of caffeinated beverage throughout the night to stay awake, then when it's time for them to go to sleep, they're going to struggle because the caffeine is still, being metabolized. It's still in their system. The other thing that could be recommended is sometimes when somebody works a night shift is that for them to even wear sunglasses on the drive home. That way, again, it's limiting the amount of light that's coming in and can help them ease into sleep better when they return home and try to go to bed. All easier said than done, but I've noted some pretty significant changes for people who really do implement these changes in their lives. And again, it's hard to think about, but we're going to talk about coping with unhelpful thoughts. So maybe that could help with some of it. So a lot of folks talk about, losing sleep. I'm losing sleep over this, or I'm thinking about that. I'm worried about this. And I can only imagine that in the past year, that's been some of it. I talked about the difficulty distinguishing what came first, the sleep problems or the other problems. And I think it's really kind of this amalgamation of them, a combination of so many things. But worrying can really keep us up at night. And I know a lot of folks with anxiety and worry, and they stay up at night. And so this may sound kind of silly, but scheduling worry time. So this is scheduling time to intentionally worry about things or think about things. So for example, at 5 p.m., I'm going to give myself 10 minutes to think about or worry about my responsibilities for tomorrow. I find it very helpful, instead of keeping things in my mind like a running to-do list, for me to write it down. So I have like lists of things everywhere, and on my phone and on reminders, because for me, it's better to set it somewhere, physically write it out, instead of trying to keep thinking about it so I don't forget. Don't forget that, don't forget that, don't forget that, because then it interferes with my sleep. I've seen some of these, really funny things online where it'll say, me waking up at 4 a.m. thinking or wondering, where's my birth certificate? Those are the random things that some people really do wake up thinking. And so if you do kind of wake up and have an issue, I recommend just writing it out somewhere and then just thinking, I already wrote about it, I'll worry about it tomorrow. With this intentional scheduling of worry time, so for example, it could be planning for the next day, it could be thinking about things that were on your mind earlier. But if the thought pops up in your mind when you're laying in bed, then you can just think, I already set it down somewhere. I already wrote about it. I don't have to think about it any longer. Or I have more worry time scheduled tomorrow. I'll just worry about it then. And it can actually be beneficial. All right. So another worry type of approach that could be helpful is this worry container. And so this is imagining that you have a container with this massive lid where you just stuff all of your difficulties, all of your worries, all of your concerns, all of your thoughts. And you take all of that and you put it into the container, you close the lid, and then you imagine you're setting it aside for later to give you space. And right now, you're just going to focus on sleep. And then you just remind yourself and that that you can go back in the morning or at any other time to take all these worries and all these concerns out and deal with them then. That can be very helpful for people, especially those who have kind of use a lot of imagery and respond well to imagery. That can be a useful tool for managing some of the worries. And then relaxation or meditation. So relaxation and meditation can have, so especially for people that I'm trying to implement relaxation and meditation and they say they don't have time for it, I recommend doing it before bed, because for many of us, breathing, that can really slow our heart rate. It can really help to slow our breathing down and have this physiological relaxation. And our parasympathetic nervous system really helps to kind of relax us. And so with relaxation or meditation, the breathing with meditation exercises, I really like, there are a ton of them like on Headspace. There's some I'm like Stop, Think, Breathe. I'm pulling mine up. That's what I'm doing at this moment, because there are some that are dedicated to sleep, and there are even some now for kids. You can see there, that's like Grover. There's a whole section on sleep. And so these exercises can be very useful. They have sleep casts, wind downs, kids and parent meditations, to-do list anxiety. And so there are these kind of wind down meditations or imagery, or there are some that help to keep your mind active enough to actually calm it. So you'll start counting, this notion of counting sheep. It really is similar to that. So you'll start by counting down from like 10,000 backwards. And so eventually you're just kind of nod off. So it's keeping your mind busy enough to eventually relax and kind of distracted from all the other like mental chatter that goes on in our mind. So the question was, what's the name of the app? That one was Headspace. And I'm not sure, but I think Headspace for some time was offering free subscriptions for healthcare providers with the NPI. I'm not sure if that's still going on, but it's worth checking out. The other good ones that I found helpful are My Life or Stop, Think, Breathe, and they have one for kids too. So that's a kids one. And then they offer one for teachers as well. So if you know any teachers, educators, they can sign up for a subscription for Stop, Think, Breathe, and they have sleep ones. Also, just on YouTube, if you look up guided meditation for sleep or relaxations for sleep, it can have a big impact. It does on me, actually. Some apps for CBTI. Yes, there are apps for CBTI. The best one is, sorry, they're like updating on my phone. Give it a second. There's something called CBTI Coach. And even if you're not doing a full CBTI protocol, this app is also can be helpful because can you see it right there? It has a little moon. It says CBTI. So if you look up CBTI Coach, that is my preferred one. And it gives a lot of tools, including a sleep diary, my sleep. It helps somebody track their sleep, learning about sleep habits, worrying in bed, napping, winding down, eating, caffeine use. So pretty much all of the things that I was talking about, this app shares information for the user. And so whenever I'm working with getting comfortable nicotine use, it's a really neat app. And so what I do with patients is I have them download it in session with me. I'll show them the app, and if they're able to at that time, or I'll help them download it. And then I recommend that they kind of go through it. There's also some guided meditations on there that can be very useful. And so I highly recommend, even supporting your patient in session if you have time. It doesn't take a lot of time to help look for some of these apps or do a brief search on things that could be helpful to them, like the CBTI app or meditations. They can YouTube, but sometimes people have never done this before, so they're not sure what to look for or how to look for it. And I'll support them in that way. And then we'll come up with a little plan about when they might use these exercises, which I usually recommend before going to bed to help them with worry or anxiety or just to overall relax. All right, so we have somebody saying that there's also an app called Bedtime where you can log your sleep, which is really neat. Thank you for that. These are some useful tools, resources. The American Psychological Association, that's where you can find some more of the information in terms of their survey from the past year that they did in February. And then the CBTI manual, Your Guide to Healthy Sleep, and the CBTI manual, as I mentioned, those are really neat resources. And the NIH also offers a guide. And so you can actually look that up. And that guide you can also provide to patients or, review yourself. And so these are all resources that you can use as providers, but also take away some resources to provide to your patients. All right. Any questions? Any other questions? I tried to give a little bit of time. I was going to lead us on a mindfulness exercise and also wasn't sure how sleepy people would get at lunchtime on a Friday, right before we typically hit that little slump. So I decided not to, but do LED lights on clocks and TVs? Yes. So TVs do affect sleep, and so do our phones. And so there are actually, the iPhone has different options to adjust your light. there's dark mode that you can, or night shift that you can set on. And so it changes the light, the type of light that's coming through. So really trying to shut down electronics, creating that buffer is really helpful. Resources or books for mindfulness practice. Yes, there is the mindfulness-based stress reduction. The tiny little light seems so bright in the dark. Yep, all of those lights. Let me see. So I'm really trying to make a dark, as dark as possible. I really like Get Out of Your Mind and Into Your Life. This is a really useful acceptance and commitment therapy workbook. And there's a lot of mindfulness and acceptance there. And then mindfulness-based stress reduction. It can also be helpful with kind of getting acquainted with how to practice mindfulness meditation, mindful eating, mindful walking, all kinds of mindfulness, all the mindfulness that you would like. Recommending white noise for sleep. Yes, white noise can be helpful for some people. And again, there's no one kind of like magic bullet for anybody. And so I suggest trying different things out, trying to change certain aspects about our environment. For some, white noise or some of the kind of like nature sounds can be useful for folks. Especially if maybe where they live in areas that are kind of noisy, or if you are working a shift. So I used to work a shift where I had to get up at 2:30 every day. And so it was really difficult for me in the summer to go to bed with the light outside because it got dark so late, and then hearing kids and people, you know, in the neighborhood just being out and playing or watering or whatever they were doing in the evening. So white noise might be helpful then. And then of course, like blackout shades or an eye mask to help limit some of that sound or the light and then the sound as well. So it's really about finding what works for you and helping your patients explore what works for them too, because it may not all be the same for everybody.
I believe there was one. Do you recommend white noise for sleep?
Oh, yes. So I think I just answered that.
Oh, did you? Okay, sorry about that.
Melatonin. So that's going to be something that I suggest you talk to your provider about, a prescribing provider about, to see if that could be helpful for you, and then when to take it, because there are certain times when it's more beneficial to take it than others. And so I don't prescribe medication, so I will leave that to some of the, I would suggest talking to your prescribing provider about that. And I hope you are able to take away some helpful information either for you and or your patients that you serve. Because again, sleep is important, and it's important we recognize how we can improve our own and those of our patients. And if anyone has any other questions, please feel free to reach out to me. And, I know CPAN offers a lot of really useful resources. So we're always here to serve you as well. You're welcome.
Yes, definitely. CPAN is always here. Great presentation, Dr. Longhurst.
Now we're all going to go have a great night's rest tonight, and I'll wake up early on Saturday and Sunday, right? We're going to start there.
Yes, we're going to wake up super refreshed.
I was thinking I'm going to have a great sleep tonight.
Okay, good. Yes. And we'll report back on Monday morning.
Will do.
Yes, that picture of that dog is very just soothing.
The
little ET dog.
Yes. I love that little guy. All of these pictures.
Oh, yes. Oh, that one I was telling Bethany, it just reminded me of an ET there.
Well, on that note, I hope everyone has a great rest of their afternoon, evening, and a good night's rest, and a great weekend.
Thank you for that great presentation. That was wonderful.
You're welcome.
Thank you.